So I had a patient come once, a husband and wife. Husband had gone to the emergency room because he had some left lower pain, left-sided pain on the lower side of his abdomen, which is where typically diverticulitis pain happens. So when he went, they did a CT scan where they saw the inflammation of these, and they told her that you have diverticulitis, and they gave him some antibiotics, and they sent him home, told him to follow up with the gastroenterologist. So he came to see me. I looked at the records. I said, well, yeah, you have diverticulitis. So usually when you have that, we do a colonoscopy to make sure everything looks okay and make sure there's nothing causing an obstruction, why you had diverticulitis. That's been the recommendation. And we said that we scheduled him for a colonoscopy, talked about you have to be on liquid diet the day before, drink a laxative, it cleans it out, then you come in, you're going to be asleep. So we'll go in, take a look at the diverticulosis. Those are the and then see if you have any polyps. So he nodded his head. His wife understood. We chose a date. We gave him his prescription. Then before leaving, he said, "May I ask you something?" Yes. And he said, "What is diverticulitis?" I just looked at him and said, well, everybody seems to know everything these days by looking up on the internet. So it was like the first time, essentially, in a lot of time that anyone has that question straight up. He was almost like naive. He didn't go on the internet and read up about it, which is not necessarily a bad thing. So it was funny that no one usually asks me. So we assumed that everybody knows it. So we sat down and explained to him that after a certain age, typically after 45 or 50, unless you're constipated sometimes earlier, you can have these little pockets in the colon, almost like pressure pockets, because you're straining, the colon's constantly moving and pushing the stool out, and it creates these diverticulosis. And quite a few people, when we do a colonoscopy, we tell them you have diverticulosis, and they always get them confused with diverticulitis, which is a different entity. One of these diverticulosis pockets, each diverticulum, and many are called, the plural is Greek or Latin, it's called diverticuli, and having them is called diverticulosis. So wordplay. And then one of them gets infected is when it's called diverticulitis. So a lot of people said, oh, I went and I had a colonoscopy and they told me I had diverticulitis. I said, no, you don't have diverticulitis unless you had pain or fever or needed antibiotics or did a CT scan. That's how you find diverticulitis. More common thing, which is mostly asymptomatic or don't have any symptoms, it's called diverticulosis. So that's a common thing. Most people say, oh yeah, I have that too. Yes, you have diverticulitis.